Effect of azithromycin against arrhythmias in patients with severe COVID-19. Azithromycin is one of the most prescribed antibiotics in the general population. It has been widely studied for its possible activity against SARS-CoV-19 virus. Multiple studies have shown that it has no benefit but also no harm in either the outpatient or inpatient setting, and still it has been widely used for it. Azithromycin has also been associated to cardiac arrhythmias in multiple studies, possibly through QTc prolongation. Patients with COVID-19 needing mechanical ventilation have a high level of mortality due to cardiac and/or respiratory failure. We present a study to assess medication-associated arrhythmias in this patient population. This retrospective cohort study identified 13,201 patients across several facilities diagnosed with COVID-19 requiring high levels of oxygen and breathing assistance for acute respiratory syndrome. We observed 846, 6.41% patients without a previous diagnosis of cardiac arrhythmias and who developed new onset arrhythmias such as atrial fibrillation and flutter ventricular arrhythmias during their hospitalization. Patients were stratified in two groups based on medication they received. A group who received only azithromycin, which was 501, 3.8%, and a group who received combination of remdesivir and dexamethasone, 10,201, 77.27%. The aim was to explore if cardiac arrhythmias were less likely to occur in patients who received only azithromycin versus a combination of remdesivir and dexamethasone. The patients with COVID-19 requiring high levels of oxygen and breathing assistance who developed new onset arrhythmias were less likely, with an odds ratio of 0.441 with a p-value of 0.0226 and confidence interval of between 0.26 and 0.73 to be exposed to azithromycin than to a combination of remdesivir and dexamethasone. It was also noted that patients who developed cardiac arrhythmias were more likely to be older, males, and non-white. In conclusion, azithromycin has been classically linked to fatal arrhythmias, but this is the first study in which patients exposed to azithromycin had been less likely to experience cardiac arrhythmias than a combination of remdesivir and dexamethasone with the previously mentioned odds ratio. So this highlights a possible protective effect in this population. However, the limitation is having a relatively small sample size and other possible confounders from the patients and the disease itself. Further research is required to investigate this. Thank you.